Welcome to The Explainer. Today, we're going to talk about the science behind a medication called Vardenafil. We're going to skip past all the brand names and really get into the nitty-gritty, the fascinating molecular stuff that happens deep inside our bodies. So, you've probably heard of Levitra, right? But how does a little pill like that actually pull off such a complex biological event? Well, it's not magic, not at all. It's actually a really specific, targeted move in a natural chemical process. Let's break down how that works. Okay, so let's start with the basics. What exactly is Vardenafil? What kind of medication are we even talking about here? Vardenafil belongs to a class of drugs called PDE5 inhibitors, and its main job to treat erectile dysfunction by helping to, achieve and maintain an erection. But, and this is super important, it only works when there's sexual stimulation. It's not an on switch. Think of it more like an enhancer for a process that's already started. So, before we can get into how Vardenafil fixes the problem, we gotta understand the problem itself. We need to look at the biology of how an erection is supposed to work in the first place. What's going on at the chemical level? Okay, so it all kicks off with this chemical chain reaction. When you're aroused, your body releases something called nitric oxide. This NO then signals the production of another really important molecule called cGMP. Now, you can think of cGMP as the green light, the go signal. It's what tells the smooth muscles to chill out and relax, which lets blood flow in and, well, you know the rest. So where do things go wrong for some people? Well, it often comes down to this enzyme called PDE5. If cGMP is the go signal, then PDE5 is the stop signal. Its job is basically to clean up the cGMP after it's done its thing. But here's the problem. If that PDE5 is a little too enthusiastic, a little too fast, it can destroy the go signal before it even has a chance to work. And the whole process just grinds to a halt. Right, so if an overactive PDE5 enzyme is the villain of the story, the solution starts to look pretty simple, doesn't it? And this is exactly where Vardenafil makes its entrance. And this is the really clever part. The whole thing starts naturally with stimulation, right? The cGMP go signal starts to build up. But then Vardenafil swoops in. It basically acts like a bodyguard for cGMP. Its only job is to block that PDE5 stop enzyme. By keeping PDE5 busy, it protects the go signal from being broken down too soon. This gives cGMP more time to do its job, keeping everything relaxed and maintaining that blood flow. And this is probably the biggest misconception out there about these kinds of meds. It is absolutely not an automatic on switch. You have to remember, Vardenafil is a supporter, not a starter. It just protects and boosts a natural response that you have already kicked off through arousal. It can't create that response out of thin air. Okay, so the science makes sense, right? Now let's get practical. How do you actually, take this stuff? What are the options? So Vardenafil usually comes in two main flavors. You've got your standard tablet that you swallow with water, and then there's one that just dissolves right on your tongue. The big difference, apart from just being easier to take, is how they play with food. If you have a big, fatty meal, it can actually slow down how fast the standard tablet gets absorbed. That's not really a problem with the dissolving kind. Of course, a doctor's going to be the one to help figure out which is the right call for you. But here's the one rule that is absolutely set in stone no matter which form you're taking. Just one. That's it. No more than one dose in a single day, period. And that leads us to what is, without a doubt, the most important part of this whole discussion. Look, understanding the science is cool, but knowing how to use a medication safely, that's everything. So let's talk side effects. The most common ones, things like a headache, maybe some facial flushing or a stuffy nose, they actually make perfect sense when you know how the drug works. Remember, Vardenafil helps widen blood vessels, right? Well, it can do that in other parts of the body too, which causes these effects. They're usually pretty mild and don't last long, but it's definitely something you should be aware of. Then we have the stuff that's much rarer but way more serious. First, something called priapism. That's an erection that just won't go away. We're talking longer than 4 hours. That is a straight-up medical emergency. You need to get help immediately, because it can cause permanent damage. Same goes for any sudden loss of vision or hearing. Don't wait, get medical help right away. Okay, now listen up, because if you only remember one single safety warning from this whole thing, I want it to be this one. This is what we call an absolute contraindication. That's a fancy way of saying there is zero wiggle room here. This is a situation where this drug must never be used. We are talking about a class of drugs called nitrates. These are often used for chest pain, things like nitroglycerin. You cannot, under any circumstances, combine vardenafil with nitrates. I don't care if it's a spray, a patch, a pill, or even recreational drugs like poppers. Mixing them can cause a massive, sudden, and potentially deadly drop in your blood pressure. They simply can't be in your system at the same time. And there are other important things to keep in mind, too. If you're on alpha blockers, say for blood pressure or prostate issues, you need to be really careful. That combination needs a doctor's close watch. And it's so important to be totally upfront with your doctor about everything. Any heart problems, any liver or kidney issues. Oh, and heavy drinking, not a great idea. It can really ramp up the side effects, so it's best to avoid it. So, what's the bottom line here? Vardenafil is a really effective tool, and that's because it's so specific. It targets one little step in a completely natural process. But that kind of power has to be treated with respect. For it to work well and safely, it all comes down to being smart about it and using it under the guidance of a doctor who knows your full story. Which kind of leaves us with a final thought, right? The key to any medication isn't just knowing what it does, but really understanding how to use it safely. So the real question is, are you having the right conversations with your doctor? Because in the end, understanding how this stuff works isn't just for science class. It's what lets you make genuinely smart decisions about your own health. Thanks for joining me for this explainer.